Hi, I'm Dr. Macon Singletary, your friendly North Raleigh periodontist. Today I want to talk about sedation or anesthetic or having you comfortable when we do a procedure for you. There are several ways to allay apprehension and make you comfortable, but the first thing is a knowledge of what we're doing. So that anxiety about the procedure itself. And the second point is that you're comfortable when we're doing it. Now, people have asked about IV sedation in the past, and IV sedation is a way of, people say, I want to be knocked out. And the problem with that is it's expensive. You have to have an anesthesiologist. Could lead up some phlebitis or inflammation of veins. And there's some post-op sequelae associated with it. It could be nausea. You have to have somebody bring you in and take you home, and there's some downtime with it. So it's an adjunct to more complicated procedures, but generally the procedures I do in my office, I generally can handle with procedures that don't cost you as much and more cost effective. First of all, just numbing you up locally. I use topical first. That's an ointment that numbs up the skin. And then we put the anesthetic in, it stings a little bit, and you're numb. And I don't ever do a procedure without you being comfortable. And if you raise your left hand, that means bug off. Now, you can't do that when I walk in the room. You got to give me a chance. If you see me in the grocery store and raise your left hand, it's going to make me feel bad. But, I try to make you comfortable. So also there's nitrous oxide. It's a gas that you put on your nose and you breathe through your nose, and it's instantaneous. It's clean. It allays your fears and anxiety. You almost feel like you're floating. And the nice thing about it is it is instantaneous. You can drive yourself in and drive yourself home, and there's no after effect, and it works while you're breathing through your nose. And just a little bit about nitrous oxide. The first time I ever was exposed to it when I was in dental school. I'm poor, so I needed money. So I participated in a pain study. Believe it or not, 8 years of age, being in the dental chair. The next time I'm in the dental chair, I'm in dental school. And then I'm in a pain study. It had to be monumental. $50 a pop, though, back when I was in school. That was good. That was enough motivation to participate. Plus, I helped write the paper. They were trying to figure out what the different kind of nerve fibers in the tooth, and hot, cold, itch, pain, and we found that there were different kind of nerve fibers. But what they would do is that they would do different things to me. They put an electrode on my tooth and they would zap it. They would start at zero, and I'd raise my hand when it would hurt. But they would do things to me that would maybe affect that sensation. One time it was acupuncture. A little Chinese fella comes in with needles this long, and he's sticking them in my thumb and my kneecaps, and he says, "Now time for Aurora." And I'm going, "What?" So he reaches back and gets this black box, and with wires on it, clips it to the needles, and I got electricity shooting up my arm, and they started cutting the rheostat up, and I said, pain, it hurts. Acupuncture didn't work. May work for some people, it didn't work for me. The second time I go in, a fella comes in, he's talking really low, and he starts swinging this thing in front of my face, and he says, "I'm going to watch this watch, and then when I count to 3, you're going to wake up and you're going to do da-da-da." And when he counted to 3, I said, that didn't work. Hypnosis is not for me. I'm just not susceptible to that. So the next time I come in, they put a little mask on my nose, and they started, he said, breathe through your nose. And I'm breathing, and my head feels like it's floating. And just all of a sudden, I'm just floating around the room, and it was sort of cool. And they started cutting the rheostat up, and not one time did I raise my hand. I mean, it's just like, I think my head was vibrating from the electricity going in my tooth. And the nitrous oxide just completely took that apprehension or that sensation of pain away. Although I felt it, I just didn't care. So when I got done, I said, "What was that?" And they said, "Well, that was nitrous oxide." I said, "Can I take that home?" But it's clean. It is instantaneous. It's not as expensive as IV sedation would be. There's no after effects. So it is an option in our office if you are apprehensive. Just ask us about it. And we'd be glad to discuss these options with you. By mouth sedation is an option as well. You do have to have somebody bring you in if you do that. So anyway, we look forward to meeting you, and keep smiling.